Good morning. Today is September 15, 2018, Class HCA 322, Healthcare Ethics and Medical Law. This assignment is for Week 2, Discussion 2. Instructor Susan Velick. My name is Norma Velasquez and I am serving as a juror. I am responsible for ruling on the case of Polidora versus Ashford Hospital. Plaintiff claims her privacy was compromised at Ashford Hospital, where she is an employee as well as a patient. An email was sent to her supervisor with her protected information as part of hospital procedures for patients scheduled for surgery. According to the plaintiff, Ashford Hospital disclosed her protected information to her supervisor, who is also a senior administrator at Ashford Hospital, without her consent. Information disclosed included the upcoming surgery, her social security number, birthday, age, residence, insurance and payment information, former surgeries, former and current medications, past medical conditions, her primary care physician, her personal psychiatrist, and other health professionals that she had seen throughout the past year. I do not agree with the plaintiff. A HIPAA violation did not occur in her case, as Ashford Hospital sent the email as a usual protocol. The plaintiff's supervisor is part of a team and she was performing her daily duties when she accessed the email. Some of the protected information that the plaintiff claims it was shared without her consent is personal information available to her supervisor. A supervisor has the right to access employees' file at any time. Employees' files contain information such as social security number, date of birth, age, and residence. The plaintiff's supervisor did not have the need to access this type of protected information through a medical record when she can find it in the employee's file. I do agree with the plaintiff. Psychiatry patient information requires a higher level of privacy, and only authorized individuals should access this type of information. However, the only information shared was the psychiatrist's name, and this does not constitute a HIPAA violation. Ms. Polidora's supervisor was only doing her job as she normally does with all other patients having surgery. I do not see any components of patient's privacy violated. The defendant presented documentation to prove that the plaintiff signed the consent to disclose her protected information to the individuals caring for her during her procedure, which includes Mrs. Polidora's supervisor. Even though Ms. Polidora's supervisor was not part of the operating team, she is a senior executive who is responsible to review operating room schedules as part of patient safety. It was the plaintiff's choice to have surgery at her place of employment. She should have known that other employees would have to access her protected healthcare information, included but not limited to her supervisor. If she had something to hide, she should have sought medical care at a different hospital. Being an employee at Ashford Hospital does not make Ms. Polidora exempt from the hospital's protocols and procedures. I am ruling in favor of Ashford Hospital. Noted in the Institute of Healthcare Improvement how HIPAA harms care, the Health Insurance Portability and Accountability Act is very complex. Physicians and healthcare organizations may not disclose protected health care information without patient permission, unless the information is being used for treatment, payment, or healthcare operations. For these purposes, patient's permission is assumed. Again, plaintiff gave her consent for surgery, and her personal protected information was used to provide medical care. In the case of Polidora versus Ashford Hospital, I am finding the defendant not guilty.